expanding NICU and newborn resuscitation services. Next, coming to immunization and infectious disease control. First one being NIS, the immunization schedule, following properly and making sure that all the children get it and get the vaccines right, and promotion of hand washing and hygiene practices. Vector control programs to prevent dengue and malaria, which includes all the insecticide, treated bed nets and all those things. Addressing malnutrition and feeding practices. So, after immunization we need to look at nutrition. So, avoid the infections and avoid malnutrition. Encouraging exclusive breastfeeding for 6 months, we have seen this repeatedly. Promotion of complementary feeding after 6 months with iron rich foods, and vitamin E supplementation and deworming programs. Enhancing health infrastructure, improving access to maternal and child health services. So, this is a broader thing, and it requires long term commitment from both public and private sector. Training of healthcare workers in neonatal and emergency obstetric care, increasing coverage of family planning programs to prevent unintended pregnancies. And then socio-economic interventions, women empowerment through education and employment, providing social safety nets and financial aid for maternal health, ensuring clean water supply and improved sanitation. So, these are the things. First one being improving maternal health. So, points regarding that. Second, strengthening neonatal care. Next one, infection control with immunization, addressing malnutrition, so and feeding practices. So, talking about the breastfeeding and all that, enhancing health infrastructure. Then finally, socio-economic interventions. So, with this we end the section on infant mortality rate. Now, we go on to the miscellaneous chapters, which include Erb's palsy, Klumpke's palsy and baby friendly hospital initiative. So, first, Erb's palsy. It is the most common brachial plexus injury. So, most common, and it typically occurs due to birth trauma. It results from C5 to C7 injury, and it leads to weakness or paralysis of infected arm. So, it is much different from Klumpke's, where there is also acquired causes, not meaning even this one is acquired, meaning not just birth trauma. It can also acquired in the older. It can also happen in the older children too. But here it is mostly birth trauma. Etiology. So, you can see most of them are during delivery. Shoulder dystocia, large for gestation age, improved instrumental delivery, and excessive lateral traction of neck during delivery. Coming to clinical features, arm held in waiter strip. So waiter strips, waiter's tip. So, you can see how it looks like. So, this is Erb's palsy, and then which is adduction and internal rotation of the shoulder, forearm extended and pronated and wrist flexed. You can see extension, adduction, forearm pronated, wrist is flexed. And then absence of these reflexes, Moro's reflex, biceps and radial reflexes, but Grasp reflex is intact, whereas in the other case, Klumpke's paralysis, it is just the opposite. Moro's and biceps, these are gone, but these are there, but Grasp reflex is absent in case of Klumpke's. Variable sensory loss in lateral arm and forearm, which is supplied by the musculocutaneous nerve. Next, coming to diagnosis, clinical assessment based on characteristic posture, so which is waiter strip and reflexes that are lost. X-ray of clavicle and shoulder to rule out fractures. MRI of brachial plexus in severe cases. Next, coming to EMG, NCS to assess nerve function. Management. So, treatment. So, first one is conservative treatment, then comes the surgical intervention. So, conservative, physical therapy, supportive care. Physical therapy, it is passive range of motion exercises to prevent contractures, passive range of motion exercises. Next, coming to next is daily stretching to maintain mobility. So, passive range of motion and daily stretching. Supportive exercise, supportive care is splinting and parental education. Next, surgical intervention. So this is in severe cases if there is no improvement within 3 to 6 months. Nerve grafting or neurolysis in case of complete. So the nerve called C5 to 7, C7 are gone, right? So if it is completely gone, if they are completely gone, you do nerve grafting or neurolysis. Tendon transfers to improve the arm function. And prognosis, so it can improve with mild physiotherapy, mild cases improve with physiotherapy, and in severe cases complete we need nerve transplant altogether, otherwise very hard to recover. With this we end the section of Erb's palsy. Next, coming to clump case paralysis, clump case palsy. So even this is a brachial plexus injury and it affects the lower nerve roots C7, C8 plus or minus T1. Paralysis of the intrinsic muscles of the hand and wrist flexors and intrinsic muscles of the hand, and typically associated with birth trauma and high energy injuries. So etiology, so as I mentioned it earlier, birth trauma, that is there, but there is also trauma in older children. So traction injury during delivery, hyperabduction of the arm during delivery, breech delivery with arm extended overhead. So you can see, you can imagine arm being extended over the head. Next, macroscopic infant. Trauma in older children, clavicle shoulder dislocation, fall from height, grabbing and hanging injury. So this, you can imagine this hanging injury. Now what are the deformities? Claw hand deformity, hyperextension of MCP with flexion of IP, loss of intrinsic hand function, absent grasp reflex. So earlier grasp reflex was present in case of this one, what is it, Erb's palsy, but here it is absent, but other two, biceps and radial reflexes are present. Sensory impairment over ulnar region, ulnar forearm and hand. And Horner syndrome is a special one if T1 is involved, where there is ptosis, which includes drooping of eyelid, meiosis, which is pupillary constriction, and hydrosis, which is loss of sweating. Diagnosis, clinical examination based on characteristic hand posture, where there is EMG, NCS, MRI of brachial plexus could be done. And even here there is conservative treatment and surgical intervention, same thing, physical therapy and passive range of motion and splinting can also be done, and then daily stretching. If it doesn't improve, we do nerve grafting and tender transfers, and same thing, mild cases recover with physiotherapy, severe cases require with complete avulsion, have poor functionality. And there is about Horner syndrome, it indicates severe injury with bad prognosis. And this is the end of clump case palsy. Finally, we come to Baby Friendly Hospital Initiative, BFHI, which was launched in 1991 by UNICEF and WHO to promote breastfeeding baby friendly hospital practices. The initiative aims to ensure that maternal child health services prioritize breastfeeding and provide skilled support for mothers. So, maternal child health services provide breastfeeding and provide skilled support for mothers. So, overall, looking at the objectives, you can form the entire answer. So, promotes exclusive breastfeeding as the best nutrition for infants. So, what does this mean? Exclusive breastfeeding for 6 months and continue up to 2 years, and trying to avoid avoiding substitutes. Then train healthcare professionals in lactational support. So, this requires a lot of policy changes in the hospitals and all that. Ensures all hospitals adopt breastfeeding friendly policies. So, that is what I mentioned. Restrict the use of breast milk substitutes. Yes, feeding bottles and teats. So, teats, already searched it here. Yeah, this one. And encourage early initiation and continuation of breastfeeding. So, these are the key objectives of BFHI. Then comes the 10 steps. Every maternity and newborn care facility should follow these 10 steps. So, and only if they follow these, we can call it BFH, Baby Friendly Hospital. Develop a written breastfeeding policy and communicate it to the healthcare staff. That forms the number 1 policy. Next is training the healthcare staff in lactation management skills. That is number 2. Number 3 is education of the pregnant woman about benefits of breastfeeding, education of pregnant women. Next, coming to fourth one, helping mothers initiate breastfeeding within 30 minutes of birth. So within 30 minutes, show mothers how to breastfeed and maintain lactation even if separated from their babies. So how to breastfeed and maintain lactation even when they are separate, that forms number 5. Next is encourage exclusive breastfeeding, no food or drink other than breast milk. Exclusive breastfeeding, no food or drink other than breast milk, that is 6. Seventh one, enable mother infant bonding forms the 7th. Encourage on demand breastfeeding, no scheduling, that is 8th. Ninth one is avoid artificial teats, pacifiers and formula supplement, that forms 9th. 10th one is support breastfeeding groups and ask the mothers to join them upon discharge, and that forms the 10th. So those are the 10 steps to successful breastfeeding, and newborn care facilities should advocate for these. Coming to the implementation of BFHI, healthcare facilities should train the staff as mentioned earlier, promote rooming in and exclusive breastfeeding in postnatal wards, restrict distribution of breast milk substitutes and advertising of infant formula, encourage low cost sustainable breastfeeding support network, and government should ensure all hospitals implement these policies. So whenever there is government intervention from the government, it ensures that these are taken seriously. Baby friendly practices in the hospitals encourage early initiation within first hour of birth, promote exclusive breastfeeding up to 6 months and continued breastfeeding up to 12 to 24 months, educate mothers on proper attachment and feeding techniques, provide lactation counseling for new mothers. Coming to impact, it increases the breastfeeding rates, reduces infant mortality rates and malnutrition, lowers the risk of infections because breastfeeding lowers the risk of infections, allergies and chronic diseases and in infants, and on maternal side it reduces the risk of postpartum hemorrhage and breast cancer risk. Overall, it strengthens